Hi, Dr. Harrison here, and today I want to talk about spinal decompression. This is a modality that we use in our office to help people avoid back surgery, whether it's low back or neck. It's non-surgical treatment for disc herniations or disc bulges that may be irritating nerves in the neck or low back and creating a lot of pain and disability for our patients. So the spinal decompression, it's important to note, is something that isn't available for all patients. We have to see first if you're a candidate. So it's very, very important to make sure if you're going to schedule an appointment, you come in with an MRI in hand. We need that MRI to see if you're a good candidate for spinal decompression. Usually this spinal decompression is used as a last resort to try to prevent a back surgery, but in my opinion, it should be used up front. And what I mean by that is typical protocol. If you go to your orthopedic surgeon with a disc herniation, they're going to start out with anti-inflammatories, painkillers, muscle relaxers. If that doesn't work, they're going to recommend physical therapy. If that doesn't work, typically they're going to recommend the surgery, maybe spinal injections before that. Again, another Band-Aid that's not going to fix the problem. And so let me tell you and discuss what that problem is. When you have a disc bulge or a herniation, what that means is that the disc that's sitting in between your vertebrae, whether it's in the neck or low back, have either begun to collapse, and kind of like a tire might start to deflate on your car, well, the edges of that tire start to bulge out. Well, that's what happens in a disc bulge in your neck or back. As the disc starts to bulge out, it might irritate nerves in the area, muscles, ligaments, but typically it will irritate those structures and start to cause pain. So that's the most common thing that we see. Then you can, if it progresses a little bit further, we see that the disc is maybe torn, and that nucleus, which is the middle portion of the disc, has started to migrate out or evaporate out or pushing out to the left or right, irritating a nerve on one side or the other. And that's where many times we'll see arm pain, numbness or tingling, or leg pain, numbness or tingling, or what people might be familiar with, sciatica, a true nerve root irritation down that leg on one side or the other. Sometimes if the disc is straight posterior, you might get it in both arms or both legs. So very, very important to see, where that disc herniation is and how it's been progressing to determine the best approach. But basically, when that disc starts to collapse, what has happened is you've lost what we call the pump mechanism in the disc. What is the pump mechanism? Well, the discs don't have their own blood supply. So the way they nourish themselves and stay hydrated throughout the day is by a process called imbibition. And the name isn't really important, but it's a passive process that occurs where as we move around throughout the day, water, oxygen, and nutrients are transported into the nucleus of the disc, and then toxins, waste products are transported back out, and it happens passively as we move around throughout the day. And they call that the pump mechanism. Well, when the disc starts to deflate, like in a disc bulge, or it starts to dehydrate because the disc has torn or herniated, and now the liquid nucleus is starting to evaporate out, we lose that pump mechanism. So the pump mechanism fails. Well, you can take anti-inflammatories and you can take painkillers and muscle relaxers. Is that going to do anything to fix that pump mechanism? No, it's not. If I get in there and just adjust your back, is it going to completely fix that pump mechanism? My opinion, no, it's not. Many times we'll get relief of symptoms long term, but as it progresses, typically we're going to need more intervention. So we need to make sure that pump mechanism is restored. Well, that's where spinal decompression comes in. Spinal decompression is computerized traction that will simulate that pump mechanism for the body. So it pulls and then it relaxes, it pulls and relaxes, and it's stimulating the flow of water, oxygen, and nutrients back into that disc, and it simulates it over and over again. Typically we'll do spinal decompression daily, usually for 8 to 9 weeks. Some people will respond a lot faster, but if it's been going on for quite some time and there's a bit of degeneration in there, 8 to 9 weeks is a pretty good estimate to make sure that we get full healing. and try to restore that pump mechanism to the best possible state we can. The discs have a great propensity to heal themselves. They just need the proper mechanism to do so. In my opinion, spinal decompression is the best way to do that. It's not going to be solved by taking a pill, an anti-inflammatory, a muscle relaxer, or a painkiller. Injecting, the spine with a steroid, it will help shrink inflammation. It may give some temporary relief. Is it going to fix that pump mechanism? No, it's not. So I hope you found this information useful. If you're interested in finding out more about spinal decompression, our consultations are always free. Please feel free to pick up the phone, call the office, bring your MRI. Let's find out if you're a good candidate for spinal decompression in the office and get you back on your way to health. And I might add too that spinal decompression has roughly an 85-90% success rate. It's non-invasive. It's an outpatient therapy. You come in, you're in for about 30 to 40 minutes. You're back out the door. So you don't have to be out of work typically. You're not going to have downtime due to the surgery. We're not putting you under, so there's no risk with anesthesia. Very, very safe, and much better probability of a good outcome than you do have with surgery. So again, I hope this information's been helpful. Give the office a call. We'll see what we can do to help you, and I look forward to seeing you soon.